Our presentation is on the typical antipsychotics, also called the first generation. Some examples include haloperidol, loxapine, chlorpromazine, dioxazine, and fluphenazine prolixin. These drugs alter effects of dopamine on the central nervous system and are used to treat symptoms of schizophrenia. Common side effects of all these drugs include neuroleptic malignant syndrome, which is a reaction that is rare due to antipsychotic drugs and includes fever, muscular rigidity, altered mental status, and autonomic dysfunction. And blurred vision, agranulocytosis, which is a severe lack of one major class of infection-fighting white blood cell, dry eyes, dry mouth, constipation, extrapyramidal effects, including dyskinesias, dystonic reactions, Parkinsonian akinesia and akathisia, and tardive dyskinesia, which is an involuntary and repetitive movement of the tongue, lips, face, trunk, and extremities that are a side effect of antipsychotic drugs.
Here we have haloperidol, also called Haldol. Its therapeutic class is part of the antipsychotics. Its mechanism of action, it alters the effects of dopamine in the central nervous system. It also has anticholinergic and alpha-adrenergic blocking activity. Its unlabeled use is used for nausea and vomiting from surgery or chemotherapy. Its therapeutic uses include diminishing signs and symptoms of psychosis, and it improves behavior in children with Tourette's syndrome or other behavioral symptoms. Its side effects include seizures, agranulocytosis, neuroleptic malignant syndrome, extrapyramidal reactions, blurred vision, dry eyes, constipation, and dry mouth. Some important nursing implications to follow are to assess mental status prior and periodically during therapy, observe patient carefully when administering medication to ensure that medication is actually taken and not hoarded, monitor for development of neuroleptic malignant syndrome and to report these symptoms immediately if they occur. And it may also cause leukocytosis, which is elevated liver function tests or elevated CPK. Monitor CBC with differential and liver function tests periodically during therapy.
Loxapine is taken as an oral medication for schizophrenia or as an inhalant for acute treatment in schizophrenia or for bipolar I disorder. It works to block dopamine and serotonin at postsynaptic receptor sites in the central nervous system and acts to diminish psychotic behavior and decrease agitation. Loxapine is contraindicated in hypersensitivity, use with other bronchospastic diseases, or in signs and symptoms of respiratory disease. Use cautiously in pregnancy, lactation, and can cause glaucoma, history of seizures, alcohol use disorder, cardiovascular disorder. Adverse reactions are worse in geriatric patients. Side effects include neuroleptic malignant syndrome, confusion, dizziness, drowsiness, headache, insomnia, weakness, blurred vision, orthostatic hypotension, bronchospasm, urinary retention, ataxia, agranulocytosis, edema, and pigment changes. Do not use loxapine with any other CNS depressants or MAOIs. Some nursing implications include monitoring patient mental status, assessing positive and negative symptoms of schizophrenia, observe patient carefully when administering the medication to ensure it is not taken, hoarded, or cheeked, monitor for onset of akathisia, institute seizure precautions, monitor for development of neuroleptic malignant syndrome, and instruct patient to notify healthcare provider if they have a sore throat, fever, unusual bleeding or bruising, rash, weakness, tremors, visual disturbances, dark-colored urine, or clay-colored stool.
Next is chlorpromazine or thorazine. Similar to the other drugs, it acts on the central nervous system to alter the effects of dopamine, and it also has anticholinergic effects. Some important side effects are neuroleptic malignant syndrome, agranulocytosis, sedation, blurred vision, dry eyes, dry mouth, hypotension, constipation, photosensitivity, and extrapyramidal effects. Some nursing implications for thorazine include periodically assess mental status, monitor for symptoms of NMS, monitor BP, give plenty of fluids, regular CBCs and liver function tests and eye exams, frequent mouth care, sugarless gum or hard candy if dry mouth occurs, and caution patient to avoid driving or operating heavy machinery if the medication causes drowsiness. Also advise patient to wear sunscreen and protective clothing if they are exposed to the sun.
The next drug is theothixine or Navine. The therapeutic use is for schizophrenia, and the action blocks postsynaptic dopamine receptors in the basal ganglia, hypothalamus, limbic system, brainstem, and medulla. It demonstrates varying affinity for cholinergic, alpha-1 adrenergic, and histamine receptors. Some contraindications are hypersensitivity, comatose or severely CNS depressed patients, bone marrow depression, or blood dyscrasias, Parkinson's disease, severe hypotension or hypertension, circulatory collapse, and children under 12, and women who are pregnant or lactating. You should use cautiously in patients with histories of seizures, respiratory, renal, hepatic, thyroid, and cardiovascular disorders, elderly or debilitated patients, or patients exposed to extreme environmental heat. Some side effects include dry mouth, constipation, urinary retention, orthostatic hypotension, decreased libido, amenorrhea, retrograde ejaculation, gynecomastia, reduction of seizure threshold, agranulocytosis, extrapyramidal symptoms, tardive dyskinesia, and NMS. Some nursing implications include monitoring for side effects such as anticholinergic effects, administering at bedtime if sedation-like effects take place, monitoring blood pressure, instructing the patient to wear sunscreen, monitoring patient's weight every other day, and ordering a high-calorie, controlled diet. The drug should be withdrawn at first sign of tardive dyskinesia. Monitor vital signs, degree of muscle rigidity, intake and output, and level of consciousness, and discontinue immediately if symptoms of NMS occur. Do not stop taking the drug abruptly. Do not smoke. Dress warmly in cold weather. Avoid alcohol, and beware of possible risk of taking during pregnancy.
Fluphenazine, also known as Prolixin, is a first-generation antipsychotic which falls under the pharmacological class of piperazine phenothiazine antipsychotics. Although the exact mechanism of action is unknown, many believe Prolixin works by rebalancing the neurotransmitter dopamine to improve thinking, mood, and behavior. Some common side effects can include a rapid heartbeat, constipation, blurry vision, dry mouth, orthostatic hypotension, and feelings of drowsiness, dizziness, or restlessness. While rare, some more serious side effects can include extrapyramidal side effects like restlessness, tremors, and stiffness, and tardive dyskinesia, which includes slow or jerky movements that one cannot control, often starting with the mouth. Patients are contraindicated from taking Prolixin if they are suspected or have subcortical brain damage, are currently receiving large doses of hypnotics, are in a comatose or severely depressed state, or has any presence of blood dyscrasia or liver damage. Some nursing implications to consider would be to assess mental health before and during therapy, observe carefully when administering oral medications to ensure that medication is taken and not hoarded, monitor patient intake and output, and to monitor for onset of extrapyramidal side effects.
This has been a Misericordia University Nursing production. Thank you for watching.